Okay, in today's video, I'll be talking about verbal communications in the dental office. So let's get started. So why are words important in verbal communications? Well, words are how we communicate with people and how they talk back to us so we can hear them. Many patients, when it comes to being a dental assistant, we use terminology that is different, that not everybody will know. So, for instance, like words that we use in treatment plans, we can use to, we're gonna have to make them more simple for an average person can know what it means. For instance, I think in one of my rotations, there was a person, he didn't know what a dry socket was. We just extracted tooth number 32, and he was like, we mentioned to him, you don't want to be, smoking because that can cause a dry socket. And he was like, oh, okay. But then again, at the end, we asked him if he had any questions, and he said yes. What exactly is a dry socket? And that's when we proceeded to ask that, it's just your mouth gets dry, that socket gets really dry and can cause pain. And that's when he understood what it meant. So asking questions it really helps patients understand, and how we can tell them, do you have any questions at the end? When speaking to, and also tone. I noticed that every patient has their own. It's best to use a tone with them, like a professional tone, of course. But once you get to know them, it's your tone can change and how they are. Some people don't really like a tone that's like really high pitch. I work with at my clinical site, there's an assistant that she's kind of like butterflies and all this stuff. She's very she talks in a very high pitched voice. Some patients don't like that. They think that they're being babied, and they prefer a more neutral tone. Also, when you're speaking too fast, that can also frighten the patient, because if you talk too fast, you're like, okay, well, we're going to pop this temporary on there, we're going to make it, and then we're going to pack some retention cord in there, and you just keep saying whatever, like the next steps it is, and they're like, whoa, slow down. Like, can you say that all again? I completely missed it. It's best, to slow down and talk to them. And some people are like, especially as people age, we tend to lose that hearing, and especially with masks that we're wearing nowadays, it's they can't really read our lips, and so it's better like to speak up a little more, but not as if you're yelling. Let's see what else. Yeah, so you don't make the patient feel pressure to understand everything at once. Take it slow, and let them process everything. Okay. When asking questions, let's see. Most patients, when you're packing cord, you tell them, hey, do you feel any discomfort? Would be a better word than pain. Because if you are to say pain, they're gonna be like, oh, whoa, I'm supposed to be feeling pain. Like that their anxiety might like skyrocket, and they'll be like, oh, they're gonna be scared every single time you go in your mouth, thinking that they're gonna feel pain. But if you use the word discomfort, it's not as bad as pain, and they'll calm down a little more, especially with patients that are very nervous. Not everyone likes the dentist. They tend to go to us more for like dental assistants. I like the dental assistants in the room, but then when the doctor comes in, they say they start drilling away. Another word, drilling. We can say preparing the tooth for a crown. People don't like it when you say drilling. They're scared of that. Okay. There's also two different types of questions that can result in like different questions. So a close-ended questions can result in a yes or no question, like, have you eaten today? Yes or no. Or an open-ended question, which results more than a yes or no answer. So one would be like, so when did the pain start? And then they'll tell you when it did start, and when after what they ate or anything like that. Okay. Nonverbal communication can show a patient how much the dental professional really cares about them, and how like their patient care is. For instance, if they let's see. Body language, facial expressions, posture, and gestures. They all play a big role in this, in nonverbal communications. For instance, if a dental assistant is to like wrap their arms around, like cross their arms, they're showing that they're not really friendly, or like, and they're like more closed, and it makes you unapproachable. But we want to be approachable by our patients, so they can tell us what they need and how they're feeling, you know. See, also, if you have your head down while you're walking, you know, not having that eye contact, that can really make a patient feel like, you know, oh, they're not really sure what they're saying, you know. You want to be confident. You want to look at them in the eye and explain to them, because you know the stuff. You just need to look at them, and that can build more, that makes you more confident in your answer, and it will reassure them that you're more that you know what you're doing. Okay, and then we have listening skills that can be and verbal, that can be incorporated into verbal communication in the dental office. Let's see. One thing is that can happen is if you're missing, you're thinking of something else, like, hey, I'm gonna do something later on after work, and you're like, oh yeah, you're on the computer and the patient is talking to you, but you're facing the computer, not really looking at them, and you choose to listen on to some words and some words not, but and you end up missing that the patient is taking a new medicine, is going to have a big surgery coming up, and that's important information to know if we're going to be jotting down notes. Let's see, what else? Yeah, so it's good to have those listening skills, because it makes the patient feel like you generally care about their health and well-being. If not, then there's no trust, and they feel like you're not really listening, and they might choose to go somewhere else if they feel like they're not being listened to. Well, that is my video, and thank you so much for watching.